For those of you who may have joined us a little bit later, to our webcast listeners, you do have the opportunity to send in questions by email, and there should be an address at the bottom of your webcast screen. But for now, we have a few extra minutes, and maybe to all three of our presenters today, you've had the benefit of hearing each other comment and speak on various aspects related to accreditation. Wondering if it has sparked, listening to the rest of the panel, any sort of new insights or ideas that would be of benefit for all of our listeners to hear. Put you on the spot.
If I may react to what Roger Strasser was telling us, I think that it's absolutely clear that in the whole process of accreditation, the issue of social accountability is a key one, because that helps us to contextualize the accreditation process. Accreditation process in Africa, in a Latin American country, in Asia, in Europe, it is completely different, because we have to look at the needs of the local population and how the institutions for health professional education address those needs appropriately. You can start from a kind of universal set of standards. But apart from that, I think the issue to what extent the recruitment, but also the retention of the graduates of a certain program in the healthcare system is realized is, I think, an important one when you look at the accreditation process. So my plea would be that we try to add that dimension consistently when we go into accreditation processes. And sometimes the conclusion of an ill-performing institution can be not to close it down, but to try to find ways for improvement so that they can, in the future, reach the standards that are needed in order to contribute, certainly in those areas where there is absolutely a need for a health workforce.
Thank you, Jan. Roger.
Yes, well, just picking up on what Jan said, I think it's fair to say that quality and accreditation really is about quality and standards. The quality is always context dependent, and so recognizing the context is important. I was really impressed by both of the other speakers and the work that they presented. In both cases, examples of what might be considered community engagement. On the one hand, asking the community, the people, what their expectations are of healthcare and health professionals, I think is a great way of really understanding what the not just their perspective, but what their needs are, so to then help to shape the education process to be responsive to those needs. And very impressive to see the midwives around the world actually asking the midwifery programs about how they saw standards and the value of some sort of common system to demonstrate those standards. I think that's likely, as this process continues, to lead to great sense of ownership and participation that may not have been there if some single authority somewhere in the United States has said there has to be accreditation of every midwifery school.
And Mary, I saw you leaning in, so last word to you.
Well, I think the whole issue of standards having to be contextualized to the setting in which the care is being given is just essential. And I would not want to see the export of anything from the United States elsewhere. I think that has had some damaging effects in some professions. And the standards, I think, for midwifery at least, were written in such a broad way that there is that way to customize and contextualize how they are provided. But this whole workshop has sort of been discussing this issue of, does accreditation, stifle or enhance innovation? And but I think for us to do this kind of project in a cost-effective means to really think outside the box and not the usual accreditation process way.
Thank you to all three of you. I know I've learned a lot, and we look forward to your questions to our webcast participants. We're going to be regrouping and continuing with the forum workshop at 2 o'clock. It's a beautiful day here in Washington, so we'll probably get a breath of fresh air and a bit of a stretch. We invite you to do the same. And again, if you have questions, please send them in. So thank you for your participation today, and a really warm thank you to our three presenters, Rogers, Jan, and Mary. Have a great afternoon.